Hello, this is Junghae. I'm going to have a presentation. I chose the case LD for my presentation, and I'm going to talk about the process of selecting and fitting an appropriate hearing aid for the patient LD who has a bilateral severe to profound hearing loss. My patient LD is a 26-year-old female and she's born deaf, and she uses ASL, American Sign Language, for communication. And she doesn't have a usable hearing in both ears except for a very limited residual hearing only at low to mid frequencies in the right ear. And also her perception and expression of speech, like spoken English, is very limited. She wouldn't vocalize, and so I wasn't able to perform speech test or word recognition test. My patient LD recently had a baby, and she's concerned about her sound awareness. She expressed that she wants to respond to her baby's sounds, her baby's voice, such as babbling or crying or laughing for interactions, and she thinks that responding to her baby's needs expressed by the sounds like a baby's crying is really important for her baby's safety. And she said that she doesn't have much need for auditory oral communication because she's deaf, and she is involved in a deaf community, and she uses ASL mostly for communication. And she has a low budget for purchasing a hearing aid, and she's not currently employed. So we have to find either hearing aid assistance program that she can apply for, or affordable amplification device. Considering all her conditions, I think affordable ultra power, like an ultra gain output hearing aid would be appropriate for her right ear to increase audibility and sound awareness. And also based on the quality of customer service and lowest failure rate, most successful users, and my familiarity and price, my options are like Phonak Nida V Ultra Power, Audicon Exceed, or Resound Enzo Q. But if neither of them is affordable for her, I think ultra power analog linear hearing aid can be an option for her. So let's say we selected Phonak Nida BTE V Ultra Power for the right ear, and I will order full shell silicone ear mold with a pressure vent and size 13 thick drywall tubing to prevent feedback and moisture. And also I'll select NAL RP for linear feeding to provide higher output. For higher output with less distortion, I would not select frequency lowering, noise reduction, nor a directional microphone. I only choose feedback suppression. The patient's goal for using hearing aid in the right ear is that she wants to improve her ability to detect and aware her baby's voice and environmental sounds when necessary, rather than to improve her ability of auditory oral communication skills. So we will focus on increasing audibility and the access to sounds surrounding her through her hearing aid. And digital signal processing, such as frequency lowering, noise reduction, those might result in gain reduction or sound distortion. Also, directional microphone that is usually activated by speech signals might not be helpful for her ASL communication with others and for her to hear sounds that her baby makes, like crying and vocalization. So we will only use feedback management and feedback suppression because her hearing aid is ultra power hearing aid that can cause frequent feedback. When I receive the device, I will check the device in the test box before I see the patient to verify that the device meets NC standard for output and NALRP target. This is like a simulated insertion gain using pink noise. And I also verify all feature settings and the function of feedback suppression. And when I see the patient, I'll check the ear mold fitting to make sure it doesn't cause any feedback. Also, I'll do a real ear measurement to verify NALRP target and feedback suppression function when the hearing aid is in her ear. I will also do functional gain test in the sound field using wobble tones, and I'll check if the half gain principle is met. And I'll also attempt to establish unaided and aided speech awareness threshold using simple stimuli like bap 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 or hello hello or bye bye. Yeah, something like that. Or unaided and aided speech recognition threshold, incorporating a picture pointing task. It is very important to have an ASL interpreter for the entire sessions with the patient LD for effective communication. And I review my patient's goals and expectations with the patient, and so we can establish realistic expectations about the hearing aid. So previously said, our goal is not improving speech recognition skills. It's for improving speech or sound awareness. I will let her know that it takes practice and time to achieve the goal of improving sound awareness. So it is important for her to wear the hearing aid all waking hours every day. I will recommend a follow-up in 2 weeks for hearing aid adjustment if necessary, and to check how she's doing with her hearing aid. And also I recommend a follow-up in 3 months for outcome measure using International Outcome Inventory for hearing aids. This questionnaire is relatively short as compared to other questionnaire, And it's simple. It has multiple choice of patient response, and it has appropriate questions for ASL users. For example, IOIHA does not have questions asking about the patient's auditory oral communication difficulty, but it has questions asking about the patient's specific hearing needs, which is appropriate for the patient who uses ASL as a primary language. Here is an example question from International Outcome Inventory for Hearing Aids. Think again about the situation where you most wanted to hear better. When you use your present hearing aid, how much difficulty do you still have in that situation? And I think this question is very appropriate for my patient LD. And I will make sure that she will let me know any problems with her new hearing aid and any improvements she's making through her new device. And I hope she enjoys her life very much with her new baby and with her new hearing device. Thank you.